everyone, welcome to our quick NCLEX guide, and today's topic is blood transfusion simplified. If you're ready to learn and succeed, hit the subscribe button and let's dive in.
Hey, I am Akwinder Kaur and welcome back to our channel Educated Nursing Review Classes. Today's topic is blood transfusion. This process is vital in saving lives and improving health outcomes in various medical situations. Stay tuned as we explore the ins and outs of blood transfusion. Let's get started. Let's start with the whole blood transfusion. Picture the regular blood flowing in your body. That's what we are talking about here. It's typically used in emergency situations like after a serious injury where someone lost a lot of blood. The key thing it does, it increases the total blood volume and enhances the blood's ability to carry oxygen. Think of it as a full service blood top up. Now, diving into the specifics, the indications for using whole blood transfusions are mainly in cases of significant hemorrhage. The hematocrit, which is likely the percentage of RBCs in the blood, is about 38%. Its primary function is to ramp up both the volume and oxygen carrying capacity, essential in trauma care. Next up, packed red blood cells or PRBCs. Imagine blood with most of its liquid part removed. This concentrates the red blood cells. It's perfect for situations where someone needs more red cells but not necessarily more fluid, like in certain types of anemia. The goal here is to boost oxygen transport around the body. Looking closer, PRBCs are used when there is decrease in red blood cell levels, but the overall blood volume is still normal. After we remove the plasma, we are left with the hematocrit of about 65% to 80%. Their main job? To restore the blood's oxygen carrying capacity. Moving on to washed packed red blood cells. These are PRBCs but with a twist. They have cleaned up to remove most white blood cells and platelets. This is particularly helpful for patients who have had reactions to previous transfusions. It's like giving a safer, customized version of PRBCs. The details: these are indicated for patients who have had sensitivities or reactions to transfusions before. The key function is reducing the risk of another transfusion reaction. It's about making transfusions safer for everyone. Let's talk about platelets now. These are tiny players in your blood that pack a punch in stopping bleeding. They come into play when someone's platelet count is really low or their platelets aren't working right. Think of bleeding disorders. But a heads up, we avoid using them in patients who have a fever. On the clinical side, platelets are used to manage bleeding due to critically low platelet counts or dysfunctional platelets. However, we steer clear of them in cases with fever. Their main role? To help blood clot and prevent excessive bleeding. Now let's discuss fresh frozen plasma, commonly known as FFP. Think of it as the all important liquid part of your blood, which we freeze and then thaw for use. It's a lifesaver in certain bleeding disorders, helped reverse the effect of blood thinners, and is used in condition called thrombotic thrombocytopenic purpura. Basically, it is a versatile component for various clotting issues. Clinically speaking, FFP is indicated for treating coagulation factor deficiencies, reversing warfarin effects, and managing thrombotic thrombocytopenic purpura. It is administered rapidly using a straight line IV set. FFP is essential in providing crucial chloric factors and other proteins. Next, let's talk about albumin. It's a protein that helps maintain the fluid balance in your blood and transports various substances. It's particularly important for patients who have experienced significant fluid loss due to burns, trauma, surgery, or infections. Think of it as a fluid balancer and carrier. On the clinical side, albumin is used for managing volume loss and hyperproteinemia. However, it is contraindicated in severe anemia and cases with risk of heart failure. It is about replenishing what's lost while maintaining the right balance. Moving on to cryoprecipitate, this component is a bit like a special forces unit. packed with specific clotting factors. It's used primarily for bleeding conditions linked to low levels of certain clotting factors, such as fibrinogen and factor 13. In terms of indications, cryoprecipitate is the go-to for bleeding due to significant factor 13 deficiency. It's like a targeted treatment for specific bleeding disorders containing fibrinogen, factor 8, and factor 13. Let's talk about leukocyte poor red blood cells. These are essentially red blood cells with most white blood cells removed. They are used to prevent febrile reactions in patients who are sensitive to them, particularly useful for those with compromised immune systems. Clinically, these are indicated for preventing febrile reactions and are a staple for immunocompromised clients. It's about providing the benefits of red blood cells without the added risks. Lastly, let's dive into immune globulin. This is a blood product containing antibodies. It's crucial for boosting the immune system in various conditions, including primary and secondary immune deficiencies, Kawasaki disease in children, and some neurological disorders. In clinical terms, immune globulin is used for a range of immune system problems. It's a key player in managing conditions like Kawasaki syndrome and certain neurological disorders, providing the necessary antibody support.
That's all for today's session on blood transfusion. If you found this video helpful, give it a thumbs up and don't forget to subscribe for more NCLEX study tips. Hit the bell icon so you won't miss any of our future videos. Happy studying. See you in next video.